Alexis. I'm going to be your physical therapist assistant today at home. Today I'm going to help you manage your symptoms for cystic fibrosis. I was wondering if you know anything about your diagnosis for CF.
I know I got it from my parents because they both have it.
So yeah, CF is from your parents. It's a genetic disease that primarily affects the lungs. And so you get CF from your parents, and there's a CF gene that each of your parents have to have in their DNA to pass it over to you. This gene is actually called the CFTR gene, and it actually stands for Cystic Fibrosis Conductance Regulator. It's kind of fancy, but and there's actually a protein that corresponds with this gene, and when that gene protein stops functioning, it causes a lot of problems within your organs and within your body, and it actually creates a really thick mucus, and that mucus lines your organs and can lead to a lot of infections and things like that. So today I'm going to help you kind of get out all of that mucus that you have built up in your lungs, and hopefully that will help prevent some of the lung infections that you've been having. So I was talking to your parents about some of the symptoms that you have from CF. They told me that you get a lot of frequent lung infections and that you guys go to the doctors a lot for that, but they haven't really had any advice on how to really clear that mucus out of your lungs and everything. So I was just wondering, what other symptoms do you have besides the frequent lung infections?
So when I will cough,
Mm-hmm.
and it feels like there's something stuck in my throat.
Mm-hmm. Okay.
And then if I cough for too long, I start wheezing, I believe, and I can feel like a wheeze deep in my lungs.
Mm-hmm.
And then after that, I get really short of breath.
Okay. All right, so now that I know all of your symptoms, I know exactly what we need to work on. So today we're going to be working on improving your breathing. So I'm going to teach you a technique to really improve your breathing. And then we're going to also do another technique to kind of loosen and expel all of the mucus that you have in your lungs. So we're going to work on that today. All right, so the first treatment I'm going to work with you on is called diaphragmatic breathing. And so basically the diaphragm is a muscle that is mainly used for breathing, and it's kind of shaped like a dome, and it sits between your lungs and your abdomen, so it's right in here. And when you have CF, the thick and sticky mucus that you have in your lung clogs up the airways, and it makes it hard for you to breathe. So with diaphragmatic breathing, it will help you use less effort and energy to breathe, and it'll help you with the shortness of breath that you've been having. And it'll also decrease the oxygen demand that you need in your body, so that's really important. And it'll strengthen that diaphragm muscle, so whenever you take a deep breath in and a breath out, it'll make it so you're only using that muscle instead of all of the other muscles that you can use to breathe. And then when I show you the technique, we're also going to do something called pursed lip breathing, and this is just kind of a technique that I'll teach you to kind of it'll also help you with the shortness of breath that you've been having, and overall this breathing technique will help you with the next treatment that I'm going to have you do, which is called chest PT, and it'll all kind of come together in the end. So let's get started. All right, so this first technique we're going to be doing is the diaphragmatic breathing techniques. So you're lying down, you put a pillow behind your head and underneath your knees for more comfort. And all you're going to do is I'm going to have you place one hand across your upper chest and then one hand on your stomach. Yep. So while your hands are there, I'm just going to have you breathe in slowly through your nose, and you should feel your stomach move out against your hand. So breathe in. Yep. And then when you exhale, you should feel your stomach muscles tightening, and I want you to kind of pucker your lips when you exhale and just push out, and then you should feel your stomach muscles tightening on the exhale. So inhale, you should feel your stomach go against your hand, and then exhale through puckered lips. Nice. And so we're just going to keep repeating this process for 5 to 10 minutes, and this really encourages you to use your diaphragm muscles when you're breathing, and it'll ultimately help you with the shortness of breath that you've been experiencing because of CF. And then I'm going to tell your parents to have you do this for 5 to 10 minutes 3 to 4 times a day, ideally, to really get that diaphragm muscle stronger. So it'll help you breathe easier in the long run. All right, so the next treatment we're going to be doing is called chest PT. This is kind of the main treatment that people do for CF, and it's really important because it helps you with a lot of the symptoms that you're having. So chest PT, the main point of it is to help drain your lungs of all the mucus that you have in there. So it'll help you loosen, mobilize, and expel all of the mucus secretions in your lungs. And this technique also helps improve your breathing patterns. It'll help you breathe easier with all of the shortness of breath you've been having. And your lungs have a lot of different lobes in them. So we're going to be draining all of the lobes of your lungs, and that will really help you breathe easier and all of that. And the diaphragmatic breathing that we just learned will also come into play during the chest PT. And I just want to make sure that you didn't eat prior to this, just to make sure that you don't get nauseous or anything during it. And between the segments, we're gonna have some rest time just to make sure that you're all right with the treatment. And I'm gonna check your lungs, the sounds of your lungs before and after, to make sure that they sound all right. And yeah, so we'll get started. There are a few things I have to show you about chest PT that I'm going to be doing during it. So there's something called percussion, and percussion kind of sounds like a horse galloping. So it's going to sound like this, it's going to look like this, my hand's going to be cupped, and it's going to be over the lobes of your lungs while I do it. It's not painful. You definitely will feel pressure when I do it, but it shouldn't hurt or anything. And if it does, let me know and I'll lessen up on the pressure. And then after that, I'm going to do something called vibration. So what that is I'm going to percuss for 3 to 4 minutes, and then afterwards I'm going to put one hand on top of the other, and I'm just going to shake like this, and that's called vibration, and that will help really get all of it out of your lungs after that. And then at the end, I'm going to give you a paper towel, and all you're going to do is you're going to hold it out in front of you, and you're going to kind of pretend like you're fogging up a mirror, and you're just going to go and we're going to do that a few times. And so we'll do all of the lobes of your lungs, and we'll just go through the process, and then afterwards I'll see what you thought. Okay? All right, Andrea. So now we're going to begin with the first part of our chest PT. So we're going to be working on your upper lobes, which are your apical segments of your lungs. So it's going to be right over here in this area. You actually have a muscle here, the upper trap, and these lobes are actually right underneath that. So I'm going to start, I'm just going to touch your skin. Can you feel me touching you? Mm-hmm. Perfect. And I'm going to listen to your lungs to make sure that I don't hear anything abnormal. I'm just going to go underneath if that's okay. Mm-hmm. Yep. And then inhale for me. Exhale. Perfect. Just going to listen to the other side. Inhale for me. Exhale. Perfect. And then inhale and exhale. Good job. Okay. To start, I'm just going to have you take this pillow and put it in your lap to have some extra comfort there. And then all I'm going to have you do is I'm going to have you scoot forward and then just sit back, kind of like you're slouching back. Yep. Perfect. Yep. Are you comfortable? Mm-hmm. Perfect. All right. So I'm going to be doing that percussion thing, or it kind of sounds like horse galloping. My hands are going to be cupped. Like I said, if the pressure's too much, let me know. And then right after that, I'm going to go in with that vibration technique, and we're going to be performing this I'm going to be doing the percussion part of it for 3 to 5 minutes, and then the vibration, we'll do a total of 6 to 8 vibrations. And when I do the vibration, all I'm going to have you do is I'm just going to have you inhale, and on the exhale, you're going to feel like a vibration, okay? Start with the percussions. So I'm going to do it right in this area, okay? We're going to do it for 3 to 4 minutes, and then we're going to go right into the vibration, okay? Let me know if it feels okay, all right? Mm-hmm. How's that, okay? Mm-hmm. Inhale, exhale. Inhale, exhale. Inhale, exhale. Perfect. All right, and then I'm going to do the other side for your left upper lobes, your left upper apical lobes, and then we'll move on. Okay, so after I listened to your lung sounds on your left side, after I did the first part of the upper lobes, now we're going to move on to the posterior segment of the upper lobes, which just means the back side. I'm going to have you lean over a table or a couch in this case, which is perfect, and give you the pillow for comfort. And then all I'm going to do is I'm going to listen to your lungs over here in this area here, and I'm going to start again by listening to your lungs. You feel me touching you? Perfect. I'm going off your shirt, sorry. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. To the other side. Inhale, exhale, inhale, exhale, inhale, exhale, inhale. Excellent. Perfect. Okay. I'm going to be doing the technique over this part. I want to be standing towards the midline, so I'm going to be standing this way for it, and we're going to do the same thing. I'm going to percuss, like horse, galloping, and then vibration, and then I'm going to listen to your lungs again, okay? Ready? All right. Inhale, exhale, inhale, exhale, inhale, exhale, and then I'm going to get tissue, and you're going to go. And then again. Perfect. One more time. Good job. All right. And then I would proceed and do the left side. And then I'm just going to listen to your lungs again. Make sure everything sounds good. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Other side. Inhale, exhale, inhale, exhale, inhale, exhale, exhale. All right, so now that we did all of the upper lobes that we had to do while you were seated, we're going to do the upper lobes while you're lying down. So now we're going to be working on the right middle and the left lingula segments. So you would be lying on your left side, so I think you can get your right lobes, and then I'm just going to have you're going to turn kind of like a fourth turn backward, which is, you're already doing that, which is perfect. And then I'm just going to do the same thing as I did before. I'm going to listen to your lungs. You feel me touching you? Yes. Okay. So to find this lobe, it's just right underneath the nipple line. It's right in here. So I'm just going to listen. So inhale, exhale, inhale, exhale, inhale, exhale. All right, that sounds good. Perfect. All right, we're going to do the same thing. I'm going to do this. I'm going to face the direction I want these secretions to go in. for 3 to 4 minutes, and then we're gonna do the vibration again. I'm gonna have you inhale and exhale, listen to your lungs, and that'll be it, okay? All right, let me know when you're ready, okay?
I'm ready.
Ready? Okay. Is that all right? Does it hurt? Okay. All right. 3 to 4 minutes is done. Inhale, exhale, inhale, exhale, inhale, exhale. Perfect. So we would do that for 6 to 8 breaths. Then I'm going to have you sit up. And then go into the paper towel. Perfect. Again. Again. Perfect. All right, and then while you're sitting up, I'm just going to listen to your lung again. All right, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Perfect. All right, so we're still working on the lower lobes of the lungs. So now we're going to work on the right and the left lateral basal segments. So I had you lie on your stomach, and then I had you do a quarter turn upward for that. And same thing, I'm gonna listen to your lungs again. So to find these lobe segments, go to the bottom of the ribs, and then you go up a few inches, and it's right in this area here for the lower lobes. And so I'm just gonna listen to it. You feel me touching you? All right, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Perfect. Great. Your lungs sound pretty good for the most part. You can definitely tell that sometimes when you breathe out, I kind of hear that kind of like wheezing sound within your lungs, but it's not too bad. And I've also noticed that it's been getting better as we've been progressing through the different lobes, which is really good. All right, so we're gonna start same thing as before, percussion, vibration, and then I'm gonna check your lungs again, all right? So I'm actually only gonna use one hand for the percussion, but then I'm gonna switch over and use 2 hands for the vibration, okay? All right, I'm gonna start, okay? Okay. So I'm giving you a pat on the back. And I'm making sure that I'm not doing it over your spine. Okay, I'm gonna do that for 3 to 4 minutes. And since that has passed, I'm gonna breathe in, breathe out. Breathe in, breathe out, breathe in, breathe out. Perfect. One more time. All right, and then after the huff cough, I'm just gonna have you listen to your lungs one more time. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Perfect. Okay, so for the last lobes that we're gonna do, these are the posterior basal lobes. So I'm gonna have you lie on your stomach, and since we're on a soft couch, we don't need pillows under the pelvis. And to find these lobes, you find the spine, and you go right off of it, and they're right in this area. Kind of the same area we were in before, just a little bit off of it. So, same thing, I'm gonna listen to your lungs again. Feel me touching you? Okay. Breathe in, breathe out, breathe in, breathe out, breathe in, All right, same thing as last time. I'm gonna use one hand for the percussions and then 2 hands for the vibrations. I'm gonna listen to your lungs again after, and then we'll wrap it up, okay?
Okay.
All right. So ready, I'm gonna start, okay?
Mm-hmm.
Do this for 3 to 4 minutes. And then inhale, exhale. Inhale, exhale. Do this for 6 to 8 breaths. Inhale, exhale. Perfect. Do your tissue. Perfect. One more. Awesome. All right. And then I'm just gonna listen to your lung one more time, and then we'll sit you up. Okay. Inhale. Exhale. Oh yeah, that sounds much clearer now. Inhale. Exhale. One more. Inhale. Exhale. All right. Perfect. Lungs are sounding pretty clear. All right, and then I'm just gonna have you sit up slowly. All right, so that concludes today's treatment. How do you think it went?
Very well.
Very well. Do you feel like you can breathe a little bit better?
Yeah, I can breathe
Do
a
you
lot
feel like-
better now.
Yeah, I noticed that you kind of stopped coughing as much as we were doing it, which is really good. Your lungs sounded a lot clearer after we completed all of the chest PT exercises. I'm gonna be coming a couple times a week to work with you. And I just want you and your parents to kind of work on that diaphragmatic breathing that I taught you. And I'll come in and do the chest PT and everything. And I think in a couple of weeks, I think you'll really see some improvements with your breathing and everything. And I look forward to working with you in the future. So,
Thank you.